Had an issue with my recording there. I apologize. I'm just going to go ahead and continue this. This is going to now be part 3 of Biochem 2, Chapter 12. So we'll keep going with vitamin D. So sources: fish oils, fortified milk, salmon, eggs, and liver. Most often the best sources for vitamin D are supplementation. At-risk populations, anybody who's not outside for a long time. Medicinal uses: if you have age-related psoriasis, osteoporosis. They've actually found really good results with psoriasis. I just had a patient the other day who manages his psoriasis with vitamin D supplementation and stress management and diet. Really cool. Doesn't take any medication for it. Too much vitamin D is toxic. So if you put too much, then you hyperkalemia, which is hyper calcium, so too much calcium in the blood, and that can cause stoppage of the heart because the calcium, the involvement of calcium with the beating of the heart. Okay, vitamin E, known as tocopherol and tocotrienol series. This is the most important natural antioxidant. You'll hear lots and lots and lots of stuff about antioxidants, free radicals, all that kind of stuff. Basically, what you need to know about that, as far as your future career and everything dealing with patients, is that there are these things called free radicals within the body. Oftentimes it's free, unbound oxygen. It becomes an issue because it likes to pull electrons off of other stuff. So we have certain vitamins and stuff that are really, really good at binding to those free radicals to prevent them from causing other stuff getting destroyed. So that's about all you really need to know about that. It's unless if you go into clinical nutrition or do the nutrition masters, you'll learn a lot more about that. And you'll touch on this process more in future courses. So it's the first line of defense against peroxidation of polyunsaturated fatty acids, which is active at high oxygen concentrations. Vitamin E is mainly found dissolved in fats in the diet, so plant oils, animal oils, some fruits, and a couple vegetables, so like asparagus. Again, the sources component of it, you might have a question or two. You might have a handful of questions kind of overarching all of the stuff. But most of this is going to be saved for when you're in your clinical nutrition course in Try 4 or Try 5. I just don't remember which try it's in, but absorption and transport. Active fat absorption promotes the absorption of vitamin E. Again, if it's impaired, you don't get it. You do the chylomicrons, all that kind of stuff. Transported in blood by the lipoproteins, uses the chylomicrons. Stored in the liver. It's an antioxidant, prevents tissue damage from free radical damages. First line of defense against peroxidation of polyunsaturated fatty acids. I'm not going to bother reading all of this. This is a lot of kind of getting into essentially just that component, the free radical type stuff. So I don't remember this being very a focus of the exam. So again, if we see something like this, then we'll come back and look at that. Selenium metabolism. Selenium is an essential component of the enzyme glutathione peroxidase. This enzyme gives a second line of defense against peroxides before they can propagate a chain reaction, causing damage to the membranes and other cell components. Maintains membrane permeability and stability, role in fertility control, improves vitamin A absorption. Some non-antioxidant roles of tocopherol, aka vitamin E. It has anti-inflammatory properties, increase protein kinase A, protein kinase C, cell proliferation, synthesis of arachidonic acid in immune cells. So think anti-inflammatory immune response type stuff. If we don't have enough vitamin E, we can have anemia and some neurologic disorders due to bad fat absorption as insufficient vitamin E absorption. Feed sources again, RDAs, those premature infants and people with GI issues. Vitamin E toxicity is mostly unlikely. A very high dose may produce some increased blood coagulation as well as increased risk of hemorrhage. Okay, vitamin K. Precursor compounds phylloquinone and menaquinone 7. Phylloquinones are found in plants. Menaquinones are found in animal tissue. And the intestinal bacteria also synthesize it. So the menaquinones also come from the intestinal bacteria. That'll be a test question. They really like this one, where that we get some vitamin K from our intestinal bacteria. So it's absorbed in the small intestine with bile salts. Requires normal fat absorption. The chylomicrons accumulated in the liver. It functions as an anti-hemorrhagic factor, leading to blood coagulation, required for the synthesis of blood clotting factors. We'll go, which I believe it is Gen Path next trimester, where you guys take a dive into the blood clotting factors and like the whole cascade chain of blood clotting. Just understand you need vitamin K to properly clot with your blood. Okay? Reduced vitamin K acts as a cofactor of the gamma carboxylase that converts glutamate to gamma carboxyglutamate to enhance calcium binding potential. This is gonna dips into it a little bit. Again, if we see questions on this, we'll come back to it. But this is, you might have a question or so from this whole chunk. More than likely, it's gonna come in the future, though, in future courses. Yeah, you get the blood clotting cascade, all of this. I don't believe he has you study this whole thing right now, or he spends a lot of time on it. Again, if he does with the questions, we'll come back to it. Honestly, what I would recommend with this, best way you're going to learn it, is probably looking up somebody who has a video specific to this cascade. I would check Khan Academy, check Ninja Nerd. They probably have something specific on this if it was covered heavily in class. I'd recommend doing that. Okay? And we'll also be able to tell if it is super important when we get to the Linus questions. The active form of vitamin K in its reduced form, which is vitamin KH2. The mechanism of action of vitamin K. The reduced form of vitamin K is the coenzyme. We're still talking about this. All of these, the different factors and prothrombin. Vitamin KH2 is converted to vitamin K epoxide. Vitamin K epoxide can regenerate vitamin K, blood clotting cascade, all of that stuff. So some of the stuff that I would remember that they might test on. Look at the enzymes. So vitamin K is the coenzyme for this guy. These are the factors, prothrombin. It helps in clotting. That's all really I would pay attention to now. Vitamin K deficiency, same as all of them. Fat malabsorption or excess antibiotic use. Think about that, because using antibiotics, you swallow antibiotics most often, destroys the gut, Biome. By destroying the gut biome, then the bacteria there are no longer, being producing the vitamin K. Vitamin K deficiency can cause hemorrhagic disease in newborn. This is why almost every single newborn is given a vitamin K shot at birth. In today's day and age, it's not like super necessary because women are taking like the prenatal vitamins and stuff, and it's unlikely that the baby will be deficient in vitamin K. But it is a good thing. My baby was born, and they gave him the vitamin K shot just because it's better to be safe than sorry. There are no negative effects, from giving vitamins. Potential for the Food and Drug Administration associated with the use of anti-clotting drugs. You'll learn more about this later on. Coumadin. People that have issues with this whole clotting cascade where they clot more than they are supposed to due to whatever reason can get drugs like Coumadin. There's also a specific blood test that's named after Coumadin that you'll learn about in the future. Since intestinal bacteria use phylloquinin and menaquinin 7 as the precursors for vitamin K biosynthesis, use of antibiotics can cause deficiency of this vitamin K in our body because, again, we're destroying the gut biome. Dark leafy green vegetables. We need this daily. Resistant to cookies. So eat your spinach, eat your cabbage, all that kind of stuff. And I don't know why liver is under dark green leafy vegetables, but that's another one where it's contained. This is where it's careful. Like liver is going to be for like most of these, because that's where it's stored. But also, if you're eating a bunch of liver, you're getting too much of some. So make sure you eat your veggies. Here's our RDAs. And vitamin K induced toxicity is unlikely, so high doses of a natural form of vitamin K precursor, phylloquinin, has no toxic effects. Menadione can be toxic, causing liver toxicity and hemolytic anemia. So again, not too much to worry about there. Okay, guys, apologize for this getting broken up into 3 parts. I don't know what happened with my recording software. Just kind of froze out there for a second. Yeah, that's all chapter 12, the fat-soluble vitamins. I will do my best to get through all of the line of learning questions. If you're in the class right now while I'm recording this, I would try to get through all the line of learning questions before your test that is upcoming. If I'm unable to do that, I will finish them at another time and get those uploaded for future people using this. Don't forget as well, the link to get any of my notes or anything else is in the description. Feel free to check that out, and have a great day.